Welcome to Alma College News at 8:30. This morning, the news team brings you a special report on steroids. But what are steroids? The term steroid is given to a variety of synthetic compounds that mimic the actions of hormones our body naturally produces. This general term includes birth control pills, cortisone, and also anabolic steroids. Anabolic steroids are defined as any one of a group of synthetic hormones modeled after the male sex hormone testosterone. These anabolic steroids can be administered using 3 different methods: oral, intramuscular injections, or subcutaneous administration using patches or creams. Due to the low bioavailability of oral administration, oral anabolic steroids must be chemically modified derivatives of testosterone in order to survive the metabolism of the GI tract. Now we go to Doug Smith, who will discuss the biological and physiological effects of steroids.
Thank you, Max, for that introduction. Once administered, steroids enter the bloodstream and are carried all over the body. However, since steroid hormones are very hydrophobic, when in the blood, they are often bound to carrier proteins. When bound to these proteins, they are inactive because they are unable to enter the cells and exhibit their effects. When not bound to these carrier proteins, steroid hormones freely enter the membrane of the target cells, where they bind to androgen receptors located within the cytosol of the cells. When bound to these receptors, a variety of effects can take place depending on the type of cell and its location within the body. The binding of these hormones can have 2 broad classes of effects: anabolic effects and androgenic effects. In general, androgenic effects stimulate the development and maintenance of male characteristics and are sometimes referred to as the side effects of steroid cycles. On the flip side, the anabolic effects of steroids are most commonly the goal of their use. Anabolic effects are the effects on cellular processes and the metabolism of energy-yielding nutrients within the cell. In muscle cells, there is an increase in protein synthesis through the formation of peptide bonds between amino acids. Experimental studies have shown that steroid use can increase lean body mass by as much as 2 to 5 kilograms in a 10-week period. This increase in lean body mass is through hypertrophy and hyperplasticity of muscle cells and fibers. In bone, these hormones have shown to increase the rate of remodeling and growth. Also, in the bone marrow, the production of red blood cells is stimulated. Side effects of anabolic steroids can vary depending on the dosage and the length of the time the steroids are used for. In many cases, there are a variety of short-term side effects that disappear once their use is discontinued. However, though long-term studies have not been completed, it is hypothesized that long-term use of anabolic steroids may result in long-term and possibly life-threatening side effects.
The side effects for anabolic steroids can be broken down into the individual organs and the systems they belong to. In the liver, the primary site of metabolism, tumors can form. With high dosages and frequency of steroids use, there's an increased risk for cirrhosis. Severe acne and formation of cysts can develop on the skin due to fluctuations in hormone levels. Jaundice often occurs due to damage to the liver. There's an increased risk for male pattern baldness with an increase in bodily hair growth. In the cardiovascular system, blood pressure has been shown to elevate due to alterations in lipoprotein levels. Specifically, LDL is increased while HDL levels are decreased. High blood pressure causes the wall of the left ventricle to enlarge because the myocardium has to work harder to open the aortic valve. As a result, there's an increased risk of heart attack. In the musculoskeletal system, short stature can result if taken by adolescents due to premature closing of the epiphyseal plate. Tendon rupture may happen due to an increase in force created by the muscle. In the reproductive system, for males, testicular atrophy may occur, gynecomastia, which is the growth of breast tissue, and infertility may occur. In females, there's an enlargement of the clitoris and menstrual dysfunction. Psychologically, there can be an increase in aggression, which can develop into what's known as roid rage. Now to Mike Bell with more on this topic.
Do steroids cause roid rage?
I don't think so. It's possible that if you believe you're big and strong and invincible, then maybe you'll do things that you wouldn't do otherwise.
This whole issue was an issue which was very controversial when it first came out, because people say, well, if someone exhibits anger or irritability on steroids, how do we know that it's caused by the steroids? Maybe it's just that irritable and aggressive people are the ones who try steroids in the first place, and it has nothing to do with the drugs.
Thank you, Mike Bell, for your wonderful input. Now over to Max for the clinical uses of anabolic steroids.
Thanks, Alexis. Those side effects have not deterred physicians from using steroids for disease treatment in the U.S. They're most commonly prescribed for hormone deficiencies during old age and adolescence, and also muscle wasting diseases. They are also being researched for treatment of HIV and AIDS. This wraps up our report on steroids. Tune in tomorrow for our special on how a local drinking team has a soccer problem. Teen drinking is very bad.
Yo, I got a fake ID though. Yeah. 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 Yeah.